Ja, jag vet att du ville börja tidigt, Benjamin. Och du har packat det här schemat.
Det är packat, ja.
Ja, toppen. Det kommer kunna kanske vara så att det droppar in lite människor. För det är ju en klassiker på fredag morgon att folk är lite sena och man inte har fått all den sömn man behöver. Men den jag tänkte passa på att hälsa välkommen. Ja, där var du. Det är en Benjamin Raki här som är från en ledamot i STP, ST-läkare i Göteborg. Som också är mindfulness-lärare och har kört en väldigt uppskattad workshop om mindfulness på såväl svenska som europeiska konferenser. Och nu hade vi möjlighet att köra den här på SPK också. Så Benjamin, varmt välkommen. Det ska bli jättekul att se detta.
Tack så mycket. Tack. Jag kan börja med att säga att det här föredraget var tänkt att hållas på engelska, så jag är ledsen om det inte har kommunicerats ut till er. Men full deltagande på svenska går helt okej. Och ni får gärna bolla tillbaka på svenska, men det kommer att hållas på engelska. Så hoppas det går an. Och vi är ett liten skara och det är helt perfekt. Det ska inte vara fler än så här. Så fint. Well, welcome to this workshop about interpersonal mindfulness, which is a practical workshop in phenomenology. I'll start with an overview of phenomenology and mindfulness, and then we'll go into the practical part of the workshop. Let's begin by thinking about a question like this. When patients think of an excellent psychiatrist, not a competent one, but a great one, what do we think come to their mind? Most patients don't say diagnostic precision. They don't say encyclopedic knowledge of the DSM. They say things like presence, warmth, the ability to listen, to truly listen, to see, to understand. And yet, these qualities are rarely trained. It's possible to train them. We focus a lot on medication, and medication is extremely important. It has its place. But comparatively, it's easy. And checklists that we use in the DSM, they're also comparatively easy. But to truly understand a human being is more difficult. To offer an intervention just by your presence is more difficult. We have phenomenologists like Carl Jaspers and psychotherapists and psychiatrists like Irvin Yalom that say that the most important factor for the patient-doctor alliance is to use the here and now. What is going on here right now between you and the patient? The phenomenologists also say that empathy, authenticity, being authentic, actually inviting authenticity and inviting the patient to be authentic are among the most important clinical tools that a psychiatrist can use. As psychiatrists, we spend most of our professional lives in the DSM, which is a map. It's a necessary map. It helps us standardize care. It helps us communicate with each other. It helps us navigate complexity. But the phenomenologists would like to remind us that the map is not the territory. Today, I would like to invite you to, for a moment, step off this map and go back into the territory again, which is this rich, profoundly rich and varied landscape of human experience, which is phenomenology. Phenomenology is the study of first-person subjective experience. When we look at a patient through a DSM lens, we're looking at them. We're looking at symptoms. When we look at patients through a phenomenological lens, we're looking with them, together with them. What do you see? What do you hear? What are you experiencing right now? We're trying to make sense of their lived subjective experience. Carl Jaspers, as I mentioned earlier, he published General Psychopathology back in 1913. And he did this in large part to try to rescue psychiatry from becoming just another branch of neurology that ignores the soul or ignores the lived experience. I've made a little tool here called Jaspers. Oh, it's very difficult for me to navigate right now, but we can think of diagnoses as stars in the sky, which are these yellow nodes right here, and around them we have symptoms. So here we have schizophrenia, and here it's very difficult to navigate right now like this, but we have symptoms. Let me see, where is delusions? So if we press on delusions here, we can see that delusions are present in different diagnoses. We have MDD, schizophrenia, but the mere fact that a patient has delusions is not indicative of a criteria being fulfilled in all of these diagnoses. The quality is very important. The person's subjective lived experience is very important. In MDD, for example, as you all know, the delusions are more preoccupied with guilt and worthlessness and shame and bodily decay, while in schizophrenia it's more persecutory in nature. And in order to differentiate between these, we need to become curious of what is the patient actually experiencing. It's an interesting tool. If you would like to try it out, you can come up to me after the workshop. Let me close this. So for Jaspers, he saw empathy and presence as clinical tools. For him, it was not just about being nice. It was the primary instrument of assessment, using empathy. He believed that clinicians must plunge into the experience of patients and see the world through their eyes, while still maintaining enough distance to be able to describe it accurately. And in order to plunge into the person's experience, we need to use the here and now. We need to ourselves be present with the patient. We need to look at the patient. We need to be here and be next to them in this journey of exploring what they're experiencing. So the phenomenologists say that presence is a clinical instrument. And as psychiatrists, we're trained to observe the patient's mind, but we neglect sharpening the very tool that we use to do that observation, our own presence and awareness. We don't train this in any way. I've had patients tell me, wow, this is the best doctor's visit I've ever had. And I'm like, but I haven't said anything. I haven't done anything. I've just been here with my gaze, with my presence. No medication, no advice, just a return to phenomenology. Indeed, presence is not just a precursor to an intervention. Presence is an intervention. A quick analogy from radiology. If a radiologist has an uncalibrated X-ray machine, the resulting image becomes fuzzy and becomes difficult to interpret. There may be a fracture there, but it's difficult to assess whether the diagnosis is valid or not. And similarly, if a psychiatrist is not present with a patient, it becomes very difficult to understand the symptoms and place them on a diagnostic spectrum, and also to indeed provide an intervention. If you have poor data in, it leads to bad analysis out. And the phenomenologists would say that just as we read DSM and other psychiatry textbooks to gather knowledge about psychiatry, we also need to work on ourselves to become more receptive, to become more present, to become more empathic with patients, become better at mentalizing. So how do we do this? Mindfulness. Mindfulness is the way. Mindfulness can be described as sometimes as a bird with two wings. as an analogy. One wing is awareness and the other is non-judgment. And awareness simply means that we are clearly perceiving what is going on in our experience right now, in all sense objects, thoughts, sensations, feelings, what we're seeing, etc. And non-judgment means to simply not reacting to what we're finding, but having an accepting stance towards what we're experiencing right now. In psychiatry, we rely heavily on language. We talk a lot. But before language, there is something more fundamental, and that's eye contact. And eye contact is one of the fastest ways to plunge yourself back into presence again. When two people look at each other without analyzing, without thinking about what I'm going to say next, without reacting to all the thoughts going on, something important happens. We start clearly perceiving the other person in a more fundamental way. And why do we then not do this? Well, eye contact is difficult because, evolutionarily, we've evolved the whiteness in our eyes to be able to assess where are people looking at any given moment. If someone is looking at you for too long, they might be in love with you or they might want to hurt you. So it's been very important for us. But making steady, respectful eye contact can also lead to several positive things. Attention can deepen. We become more aware of subtle cues, tension in the room, resistance, microexpressions, shifts in affect. Another thing that happens is that emotional contact is improved. The patient feels seen rather than evaluated. And to be frank, sometimes the emotional contact is a dance, it's a tango. And sometimes it's not solely the patient's fault that the emotional contact is decreased or not up to par. The last thing that happens is something called co-regulation. And co-regulation is basically the regulation of one person's nervous system with the nervous system of another person through simple gaze and facial expression and presence. Okay, so let's put this theory into practice because practice is very important. We're going to begin by meditating on our own. I will guide you through a mindfulness meditation to ground ourselves into the instrument that is our own body and our own phenomenology. So please take a comfortable seat that you can hold for a few minutes and simply close your eyes. Simply receive experience right now. For these next few moments, you don't need to do anything. Simply receive the sensation of sitting right now. The sensation of your legs, and your behind on the chair, how it feels to have your feet in contact with the ground. Your back. your breath. Now, focus your attention on where you feel your breath the clearest. Maybe in your abdomen or in your chest, rising and falling all on its own. Simply follow the breath in as it comes in and out as it goes out. Taking a deep breath in through the nose and letting go through the mouth. One more time. And letting go. And when you notice that you become distracted, you become lost in thought, that's completely fine. Simply become aware of the thought, let it unravel, and then come back to the breath again, where you feel it the clearest, without judging yourself. Now, let your attention go to your head, and the sensations you find on your face and your head. You're not looking for anything in particular. You're simply receiving. You keep moving down with your awareness to your neck, your throat, and your shoulders. You keep moving down your arms, forearms, soles of your hand, your fingers, moving your attention to your chest area, seeing what you find here. Maybe you can feel your heart beating. Maybe you're warm or cold. Maybe there's some vibration. Whatever there is, simply experience it. You don't even need to label it. Just receive. Moving down to your abdomen. That rises and falls with your breath. Moving down to your hips. and your legs, your thighs, knees, keep moving down with your awareness, washing over your feet and the soles of your feet. In the last minute of meditation now, simply let go of your focus and allow everything to arise and pass on its own. Sounds come and go. Your breath comes and goes. Thoughts, sensations in the body. Simply allow everything to be for a moment. You don't need to do anything. And when you feel ready, you can come back to the room again by gently opening your eyes. And keeping this attention, this presence with you. Nothing really changes when we open our eyes. Okay, so now, without speaking, without making a lot of noise, we're going to take 2 chairs and find a place here, and simply grab someone next to you without saying anything, simply with your gaze, and then moving to an area where you can be relatively undisturbed. Okay? I'll help you with some of the chairs. Hjälpa till med stolarna. Jag kör med dig. Ja. Kan vi komma hit förresten? Jag behöver vara nära här. Okay, simply close your eyes. And again, tune into your own body. Notice if anything has changed. And try to, with closed eyes now, visualize this person sitting in front of you. Trying to paint a picture of their face, their hair. how they're sitting. And then bringing back your awareness to your own body and your own experience. Noticing if anything changed. And again, moving your awareness to this image that you've created of this person sitting in front of you, almost forgetting that you have a body and becoming intently aware of this picture. And now, in a moment, I'll ask you to open your eyes in a moment. And when you open your eyes, simply look into the eyes of this person. Become intensely curious about this person. So when you feel ready, you can open your eyes. Now, as you're looking out, see if you can keep all of your attention on your own body and your own experience. Yes, you're looking out, but your entire attention is inward. Did anything change in your experience? Now, forget that you have a body and an experience, and almost throw yourselves out of your eyes and focus 100% on the other person. Now again, bring back your awareness to your own experience. And notice if anything shifted or anything changed. Simply let it be. Notice thoughts coming and going. Simply allowing everything to be. See now if you can have half of your attention inward and half of your attention outward. In a balance. Looking at this other person, notice that you have a beating heart keeping you alive, just like this person does. You have lungs oxygenating your blood, just as this person does. You have hopes, aspirations with your life, just like this person does. You have sorrow and pain in your life, just as this person does. You have a fear of being judged, just as this person does. Wanting to fit in. You want to feel loved, just as this person does. Taking a deep breath into that, in through the nose, and letting go. One more time. Just noticing what is going on here in between you right now. What thoughts are in consciousness? What does your body feel like? Everything is okay. Simply let everything be. And now find a way of thanking your partner, either with a gaze or anything. Now, the person with the longest hair on the head takes 45 seconds to simply reflect. How was this experience for you? Was it uncomfortable? How was it? And I'll tell you when there's 10 seconds left. Yes. Ska vi se. Så. So, we've done the first level of phenomenology, which is mindfulness of oneself, one's own experience. The second step, and the portal that we can say, is eye gazing. And the third step, which is the true phenomenological exercise, is something called the noticing game. And in the noticing game, we simply notice. We use the phrase I notice that, or in Swedish, jag märker att. We're taking down the tempo, slowing down. We're holding eye contact. And we're simply verbalizing our own phenomenology, moment by moment, moment by moment. So what can we notice? We can notice thoughts. We can notice sensations in the body. We can notice feelings. We can notice judgments. Whatever you're experiencing right now, I invite you to share using the phrase I notice that, or jag märker att. And when we use this phrase jag märker att, we're in effect creating a distance to what we're experiencing. There is consciousness, and then there are things happening. Thoughts are coming and going, heart is beating, there's discomfort maybe, or there's comfort. And we're not producing these things. We're not producing thoughts. We're not producing feelings. We're not producing the heart racing, or even calm. These are things happening, and then we're noticing them. And using this phrase can help diminish defensiveness. Because, okay, you're not creating this, even if it's a judgment. Or if I say, for example, I'm noticing a thought that you're judging my eyebrows right now. And then you may say, I'm noticing a pain in my lower back. So it's not a real conversation we're having. It's a moment-by-moment exploration of what is happening here. And then, okay, I realize you weren't thinking at all about my eyebrows or my hair or whatever. You were preoccupied with the pain in your lower back. So what one person says does not have to do with what the other person says. It's a moment-by-moment exploration of what is happening. Okay. So usually this workshop is around 2.5 hours. In previous conferences, we've had 1.5 hour, and now we're having 45 minutes, and we'll unfortunately just be able to do one round of this. I was planning on 2 rounds, but do we have any questions so far? So try to be in the here and now. When you notice thoughts coming, I wish we could do this at work. It's such a good tool. You're not in the present moment. You're thinking about concepts in the future. Or if you think about what all the things you have to do and all these things, you can say, I notice thoughts about my kids, because a thought comes in the present moment. But if you start rolling in that thought, then you're not in the present moment anymore. So always just coming back to what is here right now. I'm noticing a discomfort. I'm noticing I want to look away. I'm noticing I don't know what to say. I'm noticing anything that you notice. And in this way we'll explore the relational field between us. Okay? So please close your eyes again for a moment. And simply tune in to your own body and your own experience again. What is going on? Not judging anything, but simply being with it. Allowing it. And making a commitment to slowing down, not rushing, taking the time to feel, allowing silence. So when you're ready, you can open your eyes and simply start noticing. So starting to wrap up now. The time is up. Um, I'm afraid the time is up, and we don't have any more time to reflect. But I'll be here for a few moments if you would like to reflect together with me, or ask any questions about this practice. There are workshops like this if you're curious about them. And this was just a couple of minutes, but as I said, we do this practice for several hours, and you can come in. It becomes very deep very quickly, and it's very rewarding. Thank you for coming to this workshop, and I hope you enjoyed it.
Ja, tack Benjamin, och jag hoppas det var avslappnande för er med här. Vi har en kort paus nu. Dröj gärna kvar för frågor, men om en kvart börjar nästa föreläsning här, så det kan vara så att det börjar ploppa in folk nu. Tack så mycket för att ni kom. Och här får du en present, Benjamin. Tack.